Hello, everyone. Welcome to our presentation. We're going to go over the VB map, or the Verbal Behavior Milestone Assessment and Placement Program, and compare that in relation to the PEAK Relational Training System. I'm Cody Papke.
I'm Haley Petro.
I'm Barbara Schlegel.
And I'm Jody Sheets.
This is our client summary. Isaac is 4 years old. He was diagnosed with autism spectrum disorder last year at the age of 3. Currently, he receives ABA therapy at a clinic 1 day a week for 30-minute sessions, and he receives speech therapy 1 day a week for 30-minute sessions as well. His current strengths include maintaining eye contact, independent play, and gross and fine motor skills that are developmentally appropriate. And current areas of concern are that Isaac has limited language ability to express his wants and needs. He speaks mostly in echoics, and he is not engaged in cooperative play with his peers.
To begin, we're going to compare each of these assessments, starting with their age range. So typically, VB MAP is anywhere from 0 to 48 months, but it can be adjusted depending on the individual, whereas PEAK has that much broader range, starting at 0 all the way up to 16 years, but can be adjusted depending on a developmental need. For purpose and scope, VB MAP is mainly going to focus on the person's social skills and their language abilities, looking at requesting and labeling objects or items, conversational skills, and that listening and responding, as well as social behavior. Whereas PEAK is a little bit broader, it's teaching relational skills, which is that like similarities and comparisons between objects, understanding differences, spatial reasoning, and can be broadened even broader than that. For limitations, VB MAP is going to be focused on that verbal behavior, so limited and nonverbal skills, and is just going to focus on those verbal behavioral skills. It may not capture generalization, meaning that if you were to take this assessment and compare it in different areas of their life, they may not be able to use these abilities or skills in the same way, especially with different people or in different environments. And then it is going to be dependent on that observer competency, meaning that if you can't perform the assessment correctly, you're not going to get correct or accurate data on that individual. With PEAK, it is pretty complex and it's time intensive, and it might not capture all aspects that you may need in order to have a true assessment of that individual. Lastly, for measurement, VB MAP is going to be a direct measurement tool, and it has direct observation and assessments on that individual's behavior. PEAK is going to have a combination of both. The assessment includes direct observation, and then the results can be used to guide that moving forward, what interventions you may want to use. So there is that indirect and direct, but the direct measurement is there in the sense that it's involving the observing and measuring those specific behaviors.
So for data collection procedures, we're going to go towards VB MAP for Isaac. And with VB MAP, it is done on an app on the computer, and Isaac would be tested over his language, social, and academic skills, as well as barriers, which is just anything that he may be struggling with. PEAK is scored on a paper pencil sheet, and PEAK also utilizes questionnaires from parents and teachers. So for the reliability or validity of these two, that just means how trusted they are as assessments. VB MAP is frequently used to make educational decisions for children with autism, and it is ranked as moderate to strong across all areas. PEAK also has over 35 published studies on the various elements, and it is also evidence-based, which just means that it is also trusted. PEAK is also a really good assessment tool, but it is geared more towards generalization over the basics, and that's why we're choosing VB MAP. So intervention selection, VB MAP, once you do the assessments, this will offer us ideas on where to go next with Isaac. So since he is having trouble requesting items or activities, once we get his scores back, this gives us a couple ideas of where to go next and what things to work on. PEAK is a linear kind of assessment tool, and it involves direct training, generalization, and that just means that it's kind of the same where it's coming up with programs for them, but there's more focus on non-memorization and non-basic skills, which we kind of want to focus on now with Isaac.
So our next steps, it starts with running the VB-MAP assessment. It can be administered over multiple sessions. It can take up to 10 hours to administer, though that's not always the case. And then the general rule is to reassess every 6 months. You can reassess a little bit sooner, though, if you feel like the child is making a little bit more rapid progress. So we're going to take the information that we learned from the 3 assessments within the VB-MAP, the milestones, barriers, transitions assessment. Milestones covers things like requesting and labeling. The barriers assessment identifies some common barriers. Some examples would be articulation problems or hyperactivity. And then we'll use that transition assessment to assess where the best educational placement is for Isaac. Specific to Isaac, we're going to really focus on his ability to express his wants and needs a little more effectively. We're going to expand or try to expand from his echoing behavior to making more requests independently and independently labeling items. And then we're going to strive to socialize Isaac with same age peers, but we don't want to put him in a class with others who have a higher level of mastery. Thank you everyone for attending our presentation.